Go ahead, Claire.
Okay, good afternoon, good morning. My name is Claire Betker and welcome to our conversation. And to open us today, I'm going to ask Aline LaFlamme to open our session today with a prayer. Aline?
Let's see. Thank you, dear ones. I'm going to have a prayer in my own way because that's how I'm taught to open whatever we do. And if you have your own way of praying, that's fine. And if prayer is not for you, we don't impose that on you. Maybe just hold a good intention, because that's what our prayer is all about. Masi notsi, gomokota masi, masi dasi, masi dani, masi nade. Grandmothers and grandfathers, great spirit, great mystery of life, good creator of all things in this universe where we are. We thank you that we woke up to have another day to walk here on this Mother Earth. Thank you. We give thanks that we have air to breathe, Masi for the clean air. We give thanks that Grandfather's sun is shining down on us and giving us light so we could see where we are and we could see the beauty and goodness around us. Give thanks for this beautiful Mother Earth for feeding and sheltering and clothing us today. We give thanks for the pure air, for the beautiful water, the clean water that sustains our lives. We ask a good prayer and a blessing on all our relatives all over this Mother Earth, every one of them, from the four-legged kind, the winged ones, the ones living in the water, those crawling in and on the earth, all the rooted ones, and us, the foolish children of the Mother Earth, the two-legged kind. We ask for a good blessing on all of creation. And we pray right now, especially for our relatives that are sick and suffering in this pandemic or in any kind of a way. And we pray and ask a good blessing on all of those that are taking care of them and watching over them. Help us to walk with love in our hearts today. Help us to walk in honor. Help us to walk with respect for ourselves and all things in creation. And today we pray for a lot of compassion. We give thanks this way. Masi, all my relations. And I would like to say in my prayer to include, but we're all across the country, so we're all in different nations. Me, I'm here in the territory, unceded territory of the Squamish Nation, the Musqueam Nation, and the Tsleil-Waututh Nation. And I just want to recognize that I'm here as a guest on this territory, and that many of us across this country are guests in various unceded territories. Masi, all my relations. Thank you.
Thanks, Aline. That was very nice to start that way. So thank you very much for sharing that with us and for engaging us in that way. So welcome everyone, and welcome back. If this is, you're joining us again, this is the fifth in a series of conversations with Claire, or Coffee with Claire, that the Canadian Nurses Association is sponsoring and hosting as part of our response and part of our work in the COVID-19 pandemic. So for those of you who are new this week, my name is Claire Betker, and I'm the president of the Canadian Nurses Association. And I have the very distinct privilege of working from my home here in Winnipeg, Manitoba. The sort of genesis or origin of this series was really to connect and engage with our members, to talk about and have conversation about issues that were on their minds during our response, and as we move through this really unprecedented, in our lifetime anyway, situation with COVID-19. And one of the areas that you asked us in your chat box and in your Q&A was around Indigenous communities, Indigenous people, and some of the, I think, very unique challenges that Indigenous communities are facing due to COVID-19. So we have three very distinguished guests with us, and I'm actually going to ask them, first of all, to introduce themselves and just situate themselves or across the country. And I'm going to start with you, Lea Bill. and you're the president of the Canadian Indigenous Nurses Association. If you could introduce yourself. Lea.
Good morning, everybody that's online, and all my colleagues that are also in the cafe, I guess we might call it. I just send out greetings and also prayers to everyone that may have relatives or family members that are experiencing COVID at this time. I'm currently the president of Canadian Indigenous Nurses Association. But I'm also the executive director for AF&IGC, which is the Alberta First Nations Information Governance Center. So I wear two hats in my role, and currently situated in Alberta, so in the Treaty 7 territory. But of course, I'm connected right across the country with our colleagues and membership and numerous people who are part of our circle of nurses. I just want to say to all of you nurses that are online, my thoughts are with you all the time, and I do understand and know the challenges and the difficulties working with Indigenous populations particularly. And I guess as we discuss this morning, I'm looking forward to hearing from you as well, what sort of areas that you're feeling really challenged by. So good morning and thank you.
Thanks, Lea, and thanks so much for taking time out of your busy schedule to be here with us today. Okay, so now I'm going to ask Aline LaFlamme. She's on our board of the Canadian Nurses Association. She brings a very important perspective from an Indigenous perspective. So, Aline.
Let's see. My name is Aline. It means the light. My last name is LaFlamme. It means the flame. And I also carry the name Many Buffalo Running. I am a Métis great-grandmother from Alberta, but I live here in the Northwest Territories for many years, but now in the Vancouver area. And honored to be on the Canadian Nurses Association. And like my good sister Lea, I send out my greetings to all the nurses. I used to wear a shirt that said, "I love nurses," even though I'm not a nurse, but I've been a patient enough times to appreciate the gifts and the skills of nurses that keep people alive. I see nurses as healers, and I'm honored to be here with you. I'm semi-retired now, but I still do work for the Métis Nation, and also I'm an elder with Vancouver Coastal Health. So I have some involvement in various clinics and health services here in Vancouver. Merci.
Thank you so much, Aline. And I am coming down to the end of my term as the president of the Canadian Nurses Association. And one of the things as I walk away from that role that I'm going to miss a lot, one of the things that I'm taking with me is that opportunity, Aline, to be in relationship with you and what I've learned, and I know what we've all learned from you. So thank you so much for the knowledge and skill that you've brought to our board, to our association, to our membership, and to our staff. So I just really want to honor and acknowledge that, and thank you.
In my honor, my dear. Merci.
Thank you. So, and finally, we have Robin Buckland, who's the Director and Chief Nursing Officer at Indigenous Services Canada, and I've known Robin for a long time as well. So Robin, if you could introduce yourself. Thank you.
Yeah, thanks, Claire. Hi, everyone. As Claire said, I'm Robin Buckland. I'm the Chief Nursing Officer for Indigenous Services Canada. And I am also the Director General responsible for the Office of Primary Health Care within First Nations and Inuit Health Branch of Indigenous Services Canada. So we have all the nursing stations in the north. And I'm excited to be here and have this chat and coffee with Claire, although I've got my water, Claire. So thank you. Thank you for the invite.
Thank you. Well, I have my coffee. So, and anybody who knows me knows that I like my coffee. So, coffee with Claire was fitting. Okay, so we have a 45-minute conversation, of which we have a little more than half an hour left. But just before I get going into asking our distinguished, really very distinguished guests, and I want to thank them again for being here with us today. Just a little bit of logistics. So if you hover at the bottom of your screen, you'll see some icons. One is around chat, and I see many of you have already found your way to the chat room. And if you can introduce who you are, where you're from, sometimes people like to reach out to somebody they've not seen for a little bit. I see Tanya on there, Tanya Dick. So hello, Tanya. Signing in from Victoria, BC, she says. Tanya is a former board member of CNA. But just sign in there, tell us who you are, where you're from. There's another icon, it's called Q&A. And from there, we will be fielding a couple of questions, at least one question from our audience. But it's also a place where you should feel very free to ask general questions that CNA can do our best to answer. And if we don't get to those questions today, which likely we won't, we get a lot more questions than we're able to answer in our conversation, we will, and we are committed to answering those questions. So please use those two ways of entering into the conversation with us. The conversation today will be in English, but we do recognize that other people with other languages, in particular French, are online. So I'm just going to ask Josette Roussel right now. She is one of the staff at CNA to say a few words in French. And she'll be online, both in the chat box and the Q&A, and able to either help with some translation or help to answer the questions. So Josette?
Merci Claire et bonjour et bienvenue à tous les participants à la session d'aujourd'hui. Nous allons répondre aux questions en français avec la fonction chat et les questions Q et A qui sont en bas de votre écran. Alors, si vous nous envoyez des questions en français, je vais les traduire pour que nos panélistes puissent y répondre. Alors, je vous remercie et je vous souhaite une bonne session d'aujourd'hui. Over to you, Claire.
Okay, so I see in the chat box, and this is a good thing, that somebody said my audio is choppy. So I'm actually going on my headset, and I think that might help. Is that better?
Yep.
It's not the most becoming apparatus, but it certainly does help. So thanks for telling us in the chat box if you're having technical problems too. We have Elizabeth Morin, we have Carrie Schuhandler from CNA, and so we've got some staff online that can help us with. There you go, much better. Michael Villeneuve says, so that's great. So I think we're going to move right into our conversation. And so what we've been doing is actually using the chat box, using the Q&A to craft our questions. We had I think a very productive meeting the other day with Lea and Robin and Aline. And we've crafted at least our first question. So I'm going to start with Aline. Aline, as she said, is a board member of the Canadian Nurses Association, and we've been meeting weekly, almost like a huddle within our board. And Aline has shared with us many of her concerns, many of the things that she's hearing and feeling. So Aline, could you take a minute sort of to talk to this group that's here a little bit about what you're hearing, what you're feeling related to COVID-19 and in particular Indigenous communities and Indigenous people?
Mercy, thank you, Claire. In anticipation of this conversation, I contacted a great many people within various aspects of my community to ask how they were seeing things, what they were experiencing. And I'll just give you a quick flavor of some of what I heard. I spoke with one of the former AFN chiefs, and his concern was around ensuring, despite the pandemic, that treaty rights and and inherent rights were recognized. Several people responded by saying how much, and you know, I don't mean any offense to anybody, but this is what came, how much racism exists within the healthcare system. And this is a woman that's been a leader in the community for probably 40 some years. She's an elder now. And so her concern was about ongoing issues of racism and how that would affect people coming for healthcare. I was surprised at several people bringing up the issue of the pandemic from 100 years ago and all the infected blankets that were distributed in our communities and the number of deaths that occurred. And so there's real fear about, you know, this happened to us before. They gave us infected blankets. When also, you know, in residential school, we were used for experiments with various medicines. So there were some real fears that came up of mistrust from previous experiences. Some of the things that are happening in the communities that are really good, you know, many of the communities shut down very quickly. There was concern around restricting alcohol and how to handle that issue. Lots of concerns about, which have been expressed in the general community as well, in the settler community as well, about, you know, potential increases in family violence. Many people want to see more assistance to get out on the land, to just get out on the land and stay out on the land. And actually a number of people that I know have done that. They left, which people do. They go before breakup and they stay till after breakup. But in this case, they're planning to go out longer and stay longer, and more of them. There are such different ways of dealing with sickness and dealing with death in our communities. It's so crucial that nobody be left alone when they're going to die, and that families gather and stay in the hospital with somebody. And this is something that we know can't be done. Some people are solving that by, if one person can get in, taking an iPad. So that was one family's solution recently in Manitoba. So a lot of the general kinds of concerns, we know that nutrition and health are big issues, and the anxiety, the fears and worries and anxiety, the mistrust in the communities, and that feeling of not always being known or understood in healthcare facilities is another issue that that has been raised. So those are some of the things that I have heard from the downtown east side, where I do a certain amount of work. It's well, you know, as nurses, that when we have combinations of poverty and addiction, poor nutrition, trauma, and then we get COVID-19 on top of that, it's quite challenging and overwhelming. So those are just a few of the things. So many of our people are as well incarcerated, and we know that COVID-19 is racing through the jails, so that's another area of concern, and we can't go in and do our ceremonies now. So that's very, very, very hard. It's very hard. It's very challenging. But I think that's probably enough for now. Masi, thank you.
Thank you, Aline, and thanks for that very thoughtful kind of range of issues, some that we would share you know, as human beings across Canada and around the world, and others that I think are very unique and very concerning to the Indigenous people and to Indigenous communities. So thank you for that. And there may be some further questions that people might have, and certainly welcome to use the Q&A for questions or chat box if you want to add to some of what Aline said. So thank you for that, Aline. So Lea, we know that CINA, the Canadian Indigenous Nurses Association, is a very vital piece of our nursing landscape, if you will, and we really at the Canadian Nurses Association value our partnership and our collaboration with CINA. So can you talk a little bit for us, when we were in our pre-planning meeting, there was a lot of activity going on in terms of what CINA, Canadian Indigenous Nurses Association, is doing right now, and where you think that the Canadian Nurses Association, but also those more than 100 nurses that are online today with us, can really sort of come alongside and behind you in some of your efforts within CINA. So Lea?
Thank you, and thank you, Aline, for the great overview of where we're at and some of the concerns that Indigenous peoples have. I think you listed a large area of concern in many areas. So once again, greetings. And as far as CINA is concerned, we have been really working hard to maintain the consistent messaging that is being put out by the CPHO. And I think that this is really important. However, there are some challenges around relaying those messages, and part of it is, from what I'm hearing from communities as well as leadership, is the ability to translate those messages into the languages where people will fully understand and comprehend. And while we have had some translations, and they are posted on the website as well as our Facebook platform, you know, I think that there is a need for us to do more, even if it's perhaps maybe creating some short videos in language, or getting people to record those little videos so that that messaging is consistent around making sure that we have the appropriate distancing and the frequent hand washing for preventative reasons. And then also utilizing those social platforms. We have been taking advantage of that, and also posting the regular messages and the links so people can actually access resources in order for them to either plan or use in their communities. Personally, I have been in contact with health directors, and that's another area that we are working on. Is we will be joining the First Nations health managers on their town hall next week. So I'm looking forward to that, where we can also collaborate some more. Mayor Lee at the National Office, our CEO, has, of course, our main contact, and really has maintained the networking and consistently informing us as board members, and ensuring that we're well informed in our areas. And of course, as far as we are housed in the CNA building, so we're able to connect with them frequently and be on working with them consistently in many ways. The other area, of course, is the resources and toolkits. This is an area that we've recently been called to perhaps create a toolkit or for the pandemic, because there are many gaps. Many of the communities, while they had pandemic plans, didn't have all of the resources and the specifics, and some didn't even have pandemic plans, the ones that I've spoken to in some of the other regions, for example, in Saskatchewan. There were communities that didn't have any plans, and so they were scrambling and so helping them to put something in place for the short term. I think one of the real important things was the immediate shutdown. That's really what has protected many of our communities. However, we're now seeing the spread into these communities. So while they have been able to hold it off, we're now beginning to see, and it's spreading rapidly in those communities where they've had one case. Within days, it increases very, very fast. So for an example, is we had one community in Alberta where there was one case, and within 2-3 days, they had 17 cases. So they were able to identify. So the other element of that is the testing. So having the links with FNIGC and AFNIGC, one of the clear areas, of course, that is in real need of attention is the data that will help us for future planning, but also for monitoring and surveillance in the current climate. Those systems are not in place. And so I'd really love to hear from those that are part of this discussion today, what your thoughts and feelings are about that. So for now, I think I'll leave it at that and look forward to hearing what other people have to say.
Thank you, Lea. Again, some really, I think, concrete areas where we could actually collaboratively and together take some action. There's some response in the chat box to the tools, especially the videos and the visual tools. And, you know, I share your concern in terms of surveillance. It's very difficult to actually make good plans from a public health perspective or from a health perspective if you don't have solid surveillance data that actually allows you to see, you know, where those issues are and how to move ahead. So thank you for bringing that up. So I share your interest in hearing what people might say online. So Robin, poor Robin's had a few technical issues. I think she's back there and okay to speak. But Robin, you are the Chief Nursing Officer with Indigenous Services Canada. And you kind of have that, if you will, bird's eye view of the country from that place and space. So what are you seeing from your perspective in terms of challenges, but also opportunities? And I know you've also been involved in the Nursing Now initiative that was part of the 2020 Year of the Nurse and the Midwife. So I'm wondering if you could maybe add some perspectives from there as well. So Robin, over to you.
Sure. Thanks for that, Claire. And first, I do want to recognize that I am on unceded Algonquin territory. So like my colleagues before, just underlined my appreciation in terms of being a guest on this territory. Yeah, as the Chief Nursing Officer for Indigenous Services Canada, it's been a busy 8 weeks. It's a lot has been happening. I missed your introduction, Claire. I heard Leah's, which was wonderful, but I missed Aline's remark. So I hope that I'm on target here in terms of my comments. We've been doing a lot at Indigenous Services Canada in terms of trying to make sure that we have the required health human resources in remote and isolated First Nation communities. As I mentioned at the beginning, we have the nursing stations in the north, and there are a number of the nursing stations in the north that FNIB still plays a key role in terms of delivering primary care services. So we've been doing a lot of work to make sure that we've got the nurses and other health human resources available to be able to serve communities. But really probably something I want to underline is just what I did hear the comments about the challenges that people are experiencing. And on my side, what I've seen from First Nation leadership is an incredible leadership, the leadership that they're taking in terms of their pandemic preparedness and response. They're doing a super good job as Many of you know they'll have First Nation communities have closed off borders and trying to close off borders to COVID-19. So in response to that, and in partnership with First Nation leadership, we've done a number of things with our Indigenous Services nursing workforce. And the nurses are working hand in hand with communities. We've changed rotations so that nurses are not going in and out of communities as frequently. We've gone to an exclusive charter system for flying the nurses to and from communities, so they're not flying into big airports, which would increase the risk for exposure. Nurses self-isolating prior to going into communities, really working to make sure that that there is the nurses going in are healthy and in the best position to be able to support First Nation communities. Claire, you asked me to speak a little bit about the bird's eye view and some of the other work that we're doing as well. At Indigenous Services Canada, and certainly at FNIB, the First Nation Inuit Health Branch, we've got a long history of honoring Nursing Week, and we had planned to have big celebrations this year. It was going to start 10 days from now, our celebration of Nursing Week, and where we normally nominate a First Nation a nurse serving in First Nation communities, a nurse serving in Inuit communities, and then a FNIB nurse. Unfortunately, because of the pandemic, we've had to reconsider our plans, which we're still working through how we're going to celebrate at a distance, perhaps. So that's one thing I wanted to share with the group. Nursing Now, we launched that June 2019 in Vancouver with our partners, the Canadian Nurses Association, the Canadian Indigenous Nurses Association, the International Council of Nurses as well, partnering on our 3 pillars of the Nursing Now plan. The first pillar, which is being led, Claire, by the Canadian Nurses Association, is actually the nursing leadership pillar. And that pillar is really about creating a hub for nursing leadership and supporting nurses to innovate and influence policy change, which is critically important. Our colleagues, Lea and Marilee, who's participating in this conference, is our second pillar, the Indigenous pillar, is being led by Sina in partnership with ISK. And it's really about enabling and supporting current and future nurses and midwives and making sure that they have the cultural competencies to be able to deliver care to First Nation and Inuit community members. And then the final pillar, although we're not playing on this pillar, it's something that's pretty darn important to me, is the Chief Nursing Officer pillar. Our colleagues from International Council of Nurses are playing a lead role in this, and this is about just making sure that we're advocating that provinces and territories and the federal government have a Chief Nursing Officer, as we did prior to 2012, who is there to offer strategic and technical health policy advice, taking into consideration the social determinants of health and how important that is, and also health human resources, and giving that information to the Minister of Health and to all ministers so that we can have an all-of-government approach in terms of dealing with issues. Marilee from the Canadian Indigenous Nurses Association and others have actually advocated for the expansion of 2020 is to be the year of the nurse, in which we're sort of showcasing all of the good work of nurses and midwives, and Marilee and others have been advocating sort of for the extension of the year of the nurse and the midwife, and think that would make good sense. I think as we come out of this pandemic, I think we'll have even more stories in terms of what a critically important role nurses play on a day-to-day basis. But you know, the pandemic is shining a light on the importance of nursing. So Claire, perhaps I'll just leave it at that for my comments.
Thanks so much, Robin, for those comments. And that was sort of a big question that I asked you. And just know that the Canadian Nurses Association, myself in particular, I've had an opportunity for 2 conversations with the federal health minister, Minister Hadju, and have brought up, you know, the support that a chief nursing officer for Canada would provide her in the role that she's been playing, and also to the Public Health Agency of Canada and to Teresa Tam, our Chief Public Health Officer. So we have a couple of questions in the chat box, and I'm going to actually ask one of the questions to Lea and Aline, and then there's another question, Robin, that I'll come back to you with. And so the very first question that came into the box here, Aline and Lea, and I'm going to read it. It's from Shushila Saunders. Within the historical context of health epidemic experiences within the Indigenous communities in Canada, and I really want to clarify, we are speaking to First Nations, Métis people, as well as Inuit communities and Inuit people when we refer to Indigenous peoples. So within Indigenous communities in Canada, what would be helpful? So very specifically, what would be helpful for nurses to understand as we provide care to Indigenous peoples during the COVID-19 pandemic? And she finishes that question off with, what are some of the sensitivities that we need to be aware of? So if perhaps either one of you, Lea or Aline, could just a couple of ideas for Shushila, because I'm sure there's others who are thinking the same thing.
Maybe I'll start. I think as Aline spoke to at the very beginning, all Indigenous peoples, doesn't matter which tribe you come from, have experienced different levels of trauma. Some perhaps maybe direct in terms of what she spoke to, the historical trauma of the previous pandemics, whether they're deliberately infected or not, but also the whole residential school experience. Interestingly, I think if you look back at how the brain works and really how our memories work, most people will refer back to a past experience because that's considered knowledge. So our first frame of reference is what have I experienced in the past? And sometimes we're not able to decipher what's usable for us to respond to what's currently happening. And we get derailed and get in a loop of becoming frozen, what I would refer to as frozen. And so we're not able to respond in a good way, or we're not able to respond in a way that might be effective for us in dealing with the current situation. So I think this is a really key concept that nurses need to understand, that even when you're trying to relay messages or provide teachings, that because of that frozen state, individuals are not actually taking in the information and being able to use it in a way that's helpful for them. And this now is becoming part of the evidence of trauma-informed care now. So I think that that's a real critical piece. The other part of this is really understanding that when we work in communities as nurses, we're visitors, and so we need to rely on those that know the history and to listen to them. While we may have expert knowledge in terms of medical intervention and perhaps maybe the evidence that is being provided by research and or our advisors, as for example, the CPHO, we also understand that we need the help of those in the community to translate that in a way that people can take it within and use it and apply it. So those are my comments for now, and I'll hand it over to Aline.
Thank you, Lea. Aline?
Sharing with you, our thoughts are very similar in many ways. I think that it's so important. There's a big, huge cultural difference. We see it in birthing situations where in the communities, for example, everybody wants to, so up in Fort Smith, in the birthing area, there's a king size bed, because when a baby is born, we all want to pile on the bed. It's not just the mom and the dad and one baby, it's everybody. And the same is true when someone is sick. You don't leave somebody alone when they're sick, and you don't leave somebody alone when they're dying. Everybody piles into the room and stays with the person right straight through. And it's so goes against the grain. If somebody's going into the hospital, relatives go with them, or they're going into a clinic, people go with them. This idea of isolation is very against all the cultural values. There's almost nothing that's done in isolation except when you go on a fast. Other than that, everything is done together. So that's a cultural difference that's very, very important. And then when we add on, as Lea mentioned, all those layers of trauma, being alone, facing this alone, going into a clinic or a hospital alone, it's very, very difficult. And also then we're separated from our ceremonies, and our spiritual connections are very strong, whether people follow a traditional way or follow a Christian way. That spiritual connection is so much part of daily life and so important. So when people are invited to isolate, first of all, we don't have the homes, people don't have space really to do that, and it goes so against the grain culturally. And when we've got those added layers of trauma, we have an even greater need for one another. So I know that nurses going into the communities can't fix that, but at least I think to have the awareness of the tremendous challenge that people are facing when they have to be alone dealing with this disease. Exactly how to overcome it, I don't know. I can outline the problem more easily than I can suggest the solution. I do know that some people have been able to use the iPad or the iPhone or whatever and connect with their family members in that way. And on this Zoom business or the FaceTime or whatever, so people can see one another, it's helpful. In terms of our ceremonies, I don't know. I think it's just a big problem. I don't know what the solution is in that regard when someone is in the hospital. So yeah, messy. And I agree with everything Lea said.
Thank you, Aline, and thank you, Lea. And we're quickly coming to the end of our time, and we had agreed that I would ask each of you to provide some closing thoughts. So Robin, I'm actually going to go to you first for just some closing thoughts, and then I'm going to go to Lea and finally to Aline for some closing thoughts. But before I do, just thank you so much to all three of you for taking the time for being with us here today. And please type into the chat and into the Q&A, those of you who are online, further questions, further ideas, or there's some really interesting experiences that are coming in on the chat line. And Elizabeth has put up a poll asking about topics in the future. We will be having more conversations or coffee with Claire. So Robin, just a couple of closing thoughts to close out today, then Lea, then Aline.
Okay, I had to close down the poll first. Yeah, I guess my closing thoughts just are really just a reflection of the power of nurses to make a difference during this pandemic. And I think we've seen great examples of nurses going above and beyond. And I'd like to thank all of the nurses and the other health professionals who are on the call, because I've seen a few who have identified as other than nurses. So thank you for all of your work, and stay safe and stay healthy, everyone.
Thanks, Robin. Lea, some just closing thoughts from that wise mind and heart of yours.
I think my closing thoughts to all of the members that are online is just remember that really we're not alone. We know that we are connected through spirit, and I think one of the ways that we can support each other perhaps maybe is assigning or picking a day where we can have collective thought, collective prayer, and supporting one another, but also supporting those that are being affected directly by COVID. And, you know, this is something that I would like to see, perhaps maybe we could facilitate through CNA in some way, because I think that that's very helpful, because we are unable to do ceremony in many of our communities. There are some that have become very creative, including ourselves here in Alberta, where actually our knowledge pipe holders, we picked a day where we could lift the pipe together, even though we were on our own. And so I think that those kind of mechanisms are available to us still. It doesn't mean that we're, and you do feel a difference. Like I think if you read Lynn McTavish book on the power of 8, can you imagine if we had the power of all of our collective nurses, you know, thinking and about one idea, and what that would do for us to ensure that we overcome this in a good way. So thank you.
Well, I really like that, Lea, thanks. And let's see if we can make that happen in some way. Thanks, Lea, for that. Aline.
We do them at the same time together. I guess what I want to say to all the nurses online is every night I go outside and I share a drum song and I sing for you, because you're very heroic. I have a lot of love for you and a lot of respect for you, and I appreciate very much all that you're doing. It's very hard work, and in many of the places where I know you're working, it was already hard work before COVID showed up. So many blessings to you. I pray every morning for those that are ill and those that are looking after the ones that are ill. So I pray for you every day, and I sing for you every night at 7 with my community. My whole community's learned the song now. Even the children have sung it. So take good care of yourselves. We all have to do that. So take good care of yourselves. You're doing very hard work and very honorable work. And bless you all. Masi. Masi Joe. Thank you.
Thank you, Aline, for those words, and I know I personally feel that support from you, and you're sending it out there into the universe for us, and we really, really appreciate it, and we thank you for that. So with that, I'm going to close today's conversation. There's a poll here asking you how likely you are to use the information provided today. So I ask you if you can answer that poll. Please use the chat line if you've got any further thoughts yourself and or resources that you find helpful. We will be back next Friday, and our focus next Friday is on long-term care. And then we will have a session in Nurses Week as well on May the 12th. So I'm going to say farewell. One last thank you to our guests, Aline, Lea, and Robin. And also one last thanks to the very, very strong team at the Canadian Nurses Association for your incredible support to us as we're having these conversations. And thank you everybody who came today and is online, and thank you for what you do every day, wherever you are working. So thank you, and we'll see you next week. Bye. Bye now.
Merci.
Thank you.
Bye now. Bye, Lea. Bye, Aline.
Bye, Lea. Bye, Claire. Bye, Robin.
Yep.
Is Aiden there? Bye. Bye.